So this is a joint mobilization technique to help with wrist bending mobility, okay? It mostly helps with wrist mobility in this direction, and it can help a little bit with wrist bending backwards. But what we're trying to do here is we're trying to move the first row of little bones in the hand back towards the back of the hand. So we're trying to glide it back towards the back of the hand after we apply a subtle decompression or traction maneuver. So I'm going to grip the space right between my long bones. There should be a soft little ridge right there, which is basically this space, okay, a little valley there. So I'm going to go into that valley, create a little bit of traction by squeezing. You can squeeze with your index finger and thumb or your middle finger and thumb. It doesn't really matter, whichever feels more comfortable. So you're going to create a little bit of that traction, okay? And then I'm going to use a counter or a table or a firm surface to stabilize my long bones in the forearm, okay? And then right where the table ends is where the gap is that we talked about. I'm going to grab in between those small bones and the long bone. I'm going to angle my forearm so that it is perpendicular to the floor. I'm going to create a little bit of traction, so I'm pulling apart in that direction. And then I am gently leaning down towards the floor so that I'm pushing those small bones back towards my hand or towards the floor relative to the long bones. Okay, so you can see this a little bit better visually. The table ends right where the long bones end, okay? And I'm trying to take this row of bone and I am pulling them apart first, so away from my forearm and then down towards the floor, okay? And then we can do that same contract, relax technique before each glide mobilization, right? So I'm going to create a little bit of traction. I'm going to create a subtle fist with the wrist that I'm mobilizing for about 4 or 5 seconds. And then as I relax my fist, I take up slack by gripping between the bones a little bit more, a little bit of traction, and then I am pushing down towards the floor. Again, this is a gentle maneuver, okay? So that you can see my position. I'm here, and my forearm needs to be perpendicular to the floor so that when I apply that mobilization, I just lean down, okay? If my forearm is back here, it becomes a lot harder to move the bones the way I want to move the bones. So make sure you're coming up and over, forearms perpendicular to the floor, and then I am pushing down. Create a fist, contract. As I relax my fist, I take up a little bit more slack. You should feel a little bit more relative movement, and then you try to relax as much as you possibly can, and you're just leaning into it a little bit.